Okay, we're going to go ahead and get started. Can everybody see my screen okay?
Yes.
Yep.
Great, great. Well, I want to welcome you to the Big Sky Care Connect Health Information Exchange End User Training. This training is designed to get you started with the HIE. This project is funded in whole or in part under a contract with the Montana Department of Public Health and Human Services. The statements herein do not necessarily reflect the opinion of the department. I will let you know that we are not using any real patient information in this presentation. When I get into the system, I'm going to be using a test patient. I am recording this training, so I don't want to accidentally expose any real patient information within that recording. And to Jessica's point a few minutes ago, you can use this recording in any way that you need to. If you need to use it to train others on the system, if you need to use it to refresh your knowledge, or to just go back to go through this presentation again, sometimes that helps. But I will send you that link after the training today, and you can use that in whatever way you need to. If you do happen to train someone else using this presentation, just let me know so I can mark them down on the attendance list so that they don't have to take it later on. My name is Kelly McDermott. I am the training lead for Big Sky Care Connect. I do have a background in training, education, and professional writing. And I have worked on training for these types of systems before in the past. I'm very excited to work on this training with you and Montana because I think the system is really going to do great things for Montana. I've seen it do great things in other states. And I do live in Kentucky. And I do have a personal story with the HIE here in Kentucky. We do have a really robust system in Kentucky. Our oldest son was coming home from college a few years ago, and he was involved in a major car accident in a county that he had never been in before. He did have a head injury and he was unconscious, so he couldn't give the emergency department his name or his medical history. And they were able to use his ID to put his name and his birth date in the HIE, pull up all of his medical history from Southern Kentucky, where he is from, and also me as his contact, as his mom. And so they were able to treat my son, knowing what his past medical history was and knowing that he wasn't on any medication because that wasn't in the system, and able to contact me and let me know where he was. And I have to tell you that it could have taken me, if that system wasn't in place and I hadn't gotten that call, it could have taken me days to figure out where my son was. Again, he did have a head injury, so even when he was conscious, he was confused on what he was doing and where he was, and probably would not have been able to give them any contact information for a couple of days. And there's a million ways to get from here to there, and believe me, I would have driven them all until I found him, but that just saved us so much grief in our family to know where he was and to be able to get to him it was a little after 2 hours after his accident to be able to find out where he was. So not only is it going to do great things for the community and for the state of Montana, but for Montanans, but also for the healthcare workers, to give you guys a way to be able to find the information that you need quickly, to know if your patients have a medical history that you need to be aware of before you treat them, to know if they're on any medication that may affect their treatment, to give you that information quickly and to let you get back to patient care, because that's really what we want as healthcare workers, is to be able to spend more time with our patients and less time in the system. I see that somebody joined us. Can I get your name so that I can put you down on the attendance sheet, please? You may have to unmute. Okay, and if you can't unmute, if you want to just put it in the chat, then I will get you down on the attendance list there. Okay. Before we get started, are there any questions for me? And if you don't want to interrupt, I do tend to talk fast, and I welcome you to interrupt me with questions. But if you don't want to do that, you can put them in the chat and I will get to them. I have that pulled up so I can see those when they come through too. All right, we will move on here. Like I said, this training is designed to help you get started with the HIE and help you get the most out of your health information exchange experience. This presentation is geared to the data and functions that you have access to right now in the HIE. And we are still in our infant stages. We're still growing. There's still data, information, and functions that are to come for the HIE that are not in there right at this moment. And when I get into the system, I will point some of those out. If you're interested in everything that's there already and wants to come, I did send you that link to our website, which does have a copy of our user manual on there. And that does have all the information that is to come and also already currently there in the HIE. And if you have any questions on that in the future, please reach out to us and let us know. Now, we do have the contact information at the bottom of this slide for the help desk. You'll see this again later on in the presentation. But I wanted you to know that the help desk is available 24/7. If you have any questions, if you need help with the workflow, if you can't find something that you need and you're on the night shift, then you are welcome to contact them and they will help you through that. If you need something training related, let them know and they'll contact me, or you can contact me directly. I love to work with anybody on training for this. If you need materials for your organization or your department, let me know. I'm happy to create those. We do have some training videos that are available on our website also, along with those other training materials that are there, quick guides that you can print out and use at stations. So everyone knows how to log in quickly, how to find the information that they need quickly. All of these resources are available to you, but if you need anything else, please just let us know. We are happy to work with you in any way that will make this system work for you, because that's really what we want it to do. So today we are going to talk about getting started with the HIE, and then I will actually get into the system and show you how to use the search and viewer. We'll talk about a little bit about overriding patient consent. Now, I have mostly people from SCL on here, and SCL is not allowing their users to override patient consent in the system unless you are in the emergency department. And that is a policy that they have. So I will talk around that a little bit. We'll look at the clinical summary. We're going to look at and view and talk about downloading the patient summary, though SCL is also not allowing most of their participants to download the patient summary. And we'll talk about that a little bit too. We're going to look at the functions that are available on the menu and your user profile, and then we'll come back to this PowerPoint for just some simple troubleshooting, and you'll see this contact information again. Organizations that are live in the HIE right now are listed on the slide. These are organizations that are contributing data into the HIE. Now, we do have a lot of organizations that are view only, and that means that they're accessing the system to just look up the information that they need, not necessarily contributing information to the HIE. These organizations are contributing information to the HIE. We do have over 50 organizations that are in various stages of onboarding to the HIE. So they're still trying to make those connections. They're still working with the IT department. They're still working with our onboarding team in order to start contributing that data to the HIE. And as you can see, this list has gotten much longer since I gave this presentation the first time back in January. It grows every week. New organizations are signing on and contributing that data. And that will continue to happen over the course of the life of this HIE. And as that information continues to grow, then those new features and functions and the information on your patient, that's going to grow. And it's going to be a really great system to find the information that you need. The data that you're going to see right now in the HIE is limited to what those organizations are contributing. The data that you can expect to see when you get into the system are patient encounters, diagnoses, allergies, medications, lab results, diagnostic studies, problems, and patient demographics. And again, I'm going to review each of those when we get into the system so you know what to expect. We do have other information that will eventually be coming in. And you can see that when we get into the system, and you can read that information in the user manual also. When other features or functions or information starts coming into the HIE, we are creating short training videos on that feature and releasing those on our website so that you can access those short videos instead of having to take another training with me over that one function. I'm always happy to host a training, so if you need that to occur, then just let me know and we will get that scheduled. But we thought that those training videos would be a more convenient way for you guys to access the information that you may need. The HIE is role-based, so the type of access and the information that you have access to in the HIE is based on your role. There are several roles in the HIE, but we're just going to, at a high level, talk about the two most common roles, and there are options within those roles also. The clinician user, this is the user that is normally at the point of care for patients. So doctors, nurses, medical assistants, pharmacists, neurologists, oncologists, physical therapists, anyone who's at the point of care with patients usually has this role within the HIE. And again, there are some options within this role also, such as being able to access sensitive data and overriding patient consent. So those options are usually worked through on the AUA form that you sign when you sign up with the HIE in your organization. But at a high level, most clinician users can find the patient that they are trying to access. They can search for patients by demographics. They can view that patient summary document and download it if they have that option. They can override patient consent in emergency situations to view patients who have opted out of the exchange. Again, that is an option within that role. And they have access to medication data for the patient. And another common role is the clinician clerk. This is usually front office staff, coders, billers, some administrative staff have this role within the HIE. The clinician clerk can view patient records for the patient that they have information for to be able to search for. They can also search for patients by demographics and find all patients that are not opted out of the exchange. They're not allowed to override that. And they can view that patient summary document. Logging into the HIE is very easy. I wanted to give you the list of the browsers that support the HIE, pretty much anything and everything as far as browsers go. You will notice that there are some mobile device browsers there also, just in case your organization uses a tablet. I have to tell you, however, that you should not access protected health information on your mobile phone. That is something that SCL wanted me to make sure that I reiterated to you, but obviously when you're accessing protected health information, make sure that you're following your organization's policies around that. When your organization participates with Big Sky Care Connect, the help desk will create an account for you. Once that account is created, you're going to receive 2 emails from the Big Sky Care Connect help desk. These emails will contain, the first email will have the URL to the HIE. When you open up the browser, you're going to be taken to this login page that you see here on the screen. Make sure that you go ahead and bookmark that on your browser so you can access that easier in the future. It's also going to have your username. You're going to get a second email that's going to contain your temporary password. You're going to use that information to log in to the HIE. Now that temporary password is good for 60 days until you use it. If you use it, then you have to change it as soon as you use it. But if you don't use that temporary password within that 60 days, you're just going to have to contact the help desk and ask them to reissue you a new temporary password. Everything else will stay the same as far as that information goes. Again, you're going to put in that information here, and it's going to require you to change that temporary password to the password that you want to use. And you don't have to write this down or anything. This is going to be displayed on the screen when you go to change your password. And the requirements are pretty standard as far as password requirements go. That 12 characters, sometimes it's hard to get to that, but as long as you meet that 12 characters and then 3 of the other criteria on here, you're good to go with that. So you're going to put your username in again, that old password, that's going to be the temporary password that you just used, and then create your new password, confirm that password, and hit submit, and that's going to get you into the system. The first screen that you land on when you get into the system is the search and viewer screen. Do I have any questions so far? Okay, I'm going to go ahead and get logged in here. Before I log in all the way, sorry, I can't type and talk at the same time here. Before I get logged in all the way, I want to point out that we do have a new feature here where we are displaying announcements on the login page. We have 3 rows of announcements here. These will stay until a new announcement is put on here, and then it will just kick down the oldest announcement. It'll kick out the oldest announcement. So they don't really have a set time that they're going to go away. So it's just whenever a new announcement is put there, then it kicks out the oldest announcement, and it will continue to do that. I'm going to go ahead and log in here. And so you should be seeing my search and viewer screen. Again, this is the screen that you land on when you get into the HIE. There are a couple of things to point out on this screen. You can see that's broken down into different sections. You have the search by medical record number section. There is some criteria that you have to meet in order to search for a patient. And if you use this section right here, then you have to enter the facility and the medical record number associated with that patient at that facility. And a lot of times we don't have that information, but usually coders, billers, anyone in that clinician clerk role usually does have this information. And that's the best way to look for that patient that they are trying to find to verify that information that they need to verify. Again, you have to have both of these fields completed here. If you try to search with just one of those fields completed, it's going to give you an error and say that you didn't meet the minimum criteria. Now, you also see these magnifying glasses here. That signifies that there's a relevant drop-down list for that field. So for facilities, it's simply the facilities, and you can pick from that list. You can scroll through to find the one that you want. But these fields are very intuitive also, so you can actually start typing the facility that you want, and it will pull up relevant options there that you can pick from that way. So if you're quicker at typing that way, then that works for you. So most of the time, again, we're not going to have this information up here, so we will use the search by demographics. If you do have this information and you search by medical record number, it's going to pull up that exact patient for you. It's not going to give you a list of search results to have to look through. It's going to pull up that exact patient, and that's your patient. If it doesn't find that information, it's going to tell you no match was found, and you have to go back and either correct a mistake or use the demographics section to search for that patient. Search by demographics, you have several different fields here, but the minimum criteria for searching by demographics is you have to have 3 characters of the last name plus 3 characters of the first name. Or you can have just 1 character of the last name and the full date of birth. Now, if you use just the minimum criteria that I just said in the search by demographics section, it can pull up to 50 search results for you to have to look through to find your patient. What I recommend in this section, if you're going to have to search by demographics, try to put as much information as you can in here to refine those search results. So if you have the full last name, if you have the full first name, and if you have the full date of birth, that's going to reduce those search results down to 7, maybe 10 at the most, which is a lot more manageable than 50. Of course, sometimes we just have the minimum criteria and we just have to deal with it at that point. But as much information as you can to refine those search results here will help with that. And these fields also allow you to tab through them. So if you're not a mouse person, if you don't like having to click in the fields and then type and then click and then type, then you can actually tab through these fields. So I can put in the full last name of my patient, tab, full first name of my patient, tab, tab, tab. And then for the date of birth, you have a couple of different options. You can use the widget here by simply selecting the calendar. That's going to drop down today's date, which never helps you for a birthday. So go up here and select the month and the year. Do not select the month first, select the birth year first, because if you don't, it's going to kick out that month when you go to select it. So go up here to the year, scroll through until you find the birth year that you need, then select the month, then the day, and it's going to put it in the format for you. Now that's a lot of steps there. So again, I like to type and I go a little bit faster doing that. So this field will actually allow you to put in the 2 numbers for the month, the 2 numbers for the day, and the 2 numbers for the year, and hit enter, and it will format it for you. So if typing is quicker for you, then you have that option. Now, the 2 numbers for the year only works if that birth year is in the 1900s. If the birth year is in the 2000s, then simply just put in all 4 numbers of the birth year, and it will still convert it that way for you. So here I've more than met the minimum criteria to perform a search for my patient. And again, this could reduce those search results down quite a bit for you if you have in just this information. If you don't have the date of birth, let's say that we have the full last name, the full first name, just putting in the zip code, sometimes even the city will help reduce those search results for you. So use the fields that you have the information available for in order to reduce those. Now let's say that I do just have the minimum criteria up here. I can actually help the HIE filter those search results just a little bit more. Now we don't have cohorts and relationships yet. Those are features that are coming for the HIE. You can read about them in the user manual. And again, when they are implemented, I will release a short training video on them so you know how to use those features. But we do have this restrict facility. Now, right now, what I'm telling the HIE to do is to look for any type of matching information in the entire HIE database from what I have listed here. So each of these fields in the search by demographics section has an algorithm that is based off of spelling errors or phonetics. So that way, if I spelled something wrong, it's still going to pull in some things that may match what I was trying to put in there. Also, if I could get it in there phonetically correct, it's probably going to pull up that patient, even if I don't know how to spell that last name or that first name. So keeping that in mind, if we tell the HIE to, hey, I just want you to look in this one facilities database for this matching information, it will help refine those search results a little bit more. Now, it's not just pulling in the record from that one facility. It will pull in all of the patient record for that patient. It's just searching the database related to that facility for any matching information that I may have up here. Are there any questions over that? Okay. So I can tell it here that I only want you to look in this facilities database for this patient information here or any matching information, something that may match there. This could get me maybe 4 or 5 search results instead of that 50 that I was talking about before. Now I am again just using a test patient. So this is the only patient it's going to pull up for me because that's what I am in and I'm recording and I don't want to accidentally expose any real patient information. Before I do this search though, let me talk about overriding patient consent here. Now again, SCL is only allowing their emergency department staff to use this override function. And what this does is if a patient has opted out of participation from the HIE, then their information is not going to display here when we do our search. Big Sky Care Connect does follow an opt-out model for patient consent. Patients can go to our website, fill out the opt-out form, it gets submitted to the help desk, and they will opt them out. Some facilities are printing off that opt-out form and offering it to their patients also, but most organizations are just pointing the patient to our website in order to opt out if that is their wish. It's the same procedure to opt back in, just so you know. But if a patient has opted out of participation from the HIE and I need to see their records because it's an emergency situation, then this is where I would come to do it. Now, we also have a couple of facilities that are 42 CFR Part 2 facilities. And what this means is that all of their information is coded as sensitive. So if I needed to see a patient from a 42 CFR Part 2 facility, and I couldn't find the record in here, but I knew that they'd come from that facility, that they do have some information from that facility, and I was in a role and had the permissions to be able to override it. This is also where I would do that override for that sensitive data to be able to view it. So what I would do is come down here to override and select that checkbox. That gives me some other fields that are required. I am required to put in a reason. For me, it is simply training. Authorized by the patient. If it is not authorized by the patient, let's say that David has shown up in my emergency room, he's unconscious. I need to know if he's on any medications or has any prior conditions that may affect his treatment. So let's say that I override it as his clinician or his spouse overrides it for me. I can uncheck that box and actually put in that information here for that override. The authorization type does default to emergency. Again, follow your organization's policies around when it is okay for you to override patient consent, because all of this information does go on an audit log report under your username. So it can be traced back to you. Every single patient that you override, it can be traced back to you. If you do not have this option to be able to do this, when you go to select that checkbox, it's going to give you a stop sign and it won't let you check it. So you can't accidentally be able to access this or do this override without having that option to do it. Okay. So I just wanted to show you that again. SCL is only allowing their emergency department staff to do this type of override here. Again, I've more than met the criteria here. I'm going to go ahead and search for my patient. On the patient search results here, now again, if I wasn't just looking for my test patient, I could have 3 or 4 patients listed here with the criteria that I entered on the search. That's where this weighted match column comes into play. The more it matches, the higher it will be on the list. So it always filters the one that matches the best at the top and then filtered down from there. So that's where this comes into play. That algorithm is really weird. Sometimes I don't know how they make those numbers there, but just know that the best one that matches will be at the top. So most likely your patient is going to be towards the top of the list. Now, if I'm still not sure that this is the David that I want to access, you do see this arrow here and all the patients will have that here. This is the identifiers for this patient. Now, if I had a whole list of patients and I wanted to see all the identifiers to see which patient was the one that I wanted to access, I could use this icon here and it will open up all of those for me. Or you can just use the arrow beside the patient that you're interested in. Now, there can be more than one line here. Some have many lines underneath of it. And what this is telling me is that David has information that's been contributed to his medical record from this facility under this medical record number. Now, in the future, I could use this information to search for David because I can use that search by medical record number section at the top of the search and viewer, put in this facility, that medical record number, and it would pull up David's record for me. It also would have, if there's any aliases, those would be listed down here. Any address changes could be listed here. And then you can see these clinical icons here. There is a clinical icon quick guide on the website and those materials that I sent you the link to, and it has a picture and a description of every single icon that you could possibly see in the HIE. But after you're in here a couple of times, you'll be able to figure it out pretty quickly. And you can scroll over these to tell what they are. So I can tell that in his record, he has some allergies, he has a lab order, he has an encounter, he has some patient demographics, he has a diagnosis, he has radiology orders, and he has medications in his record. These are all things that have been contributed from this source here. So this facility under this medical record number has contributed this information to his medical record. Again, most patients have several different sources listed here. That can be listed underneath of their name. He is a test patient, so he only has one here. Any questions over that? Okay, I can click anywhere on either one of these lines to be taken to David's record. And when I first get to a patient, I am brought to the clinical summary. The clinical summary is really designed to give you that quick overview into the patient's record. So hopefully you can find the information that you need here and get back out of this patient record and get back to patient care. Let's talk about this banner up here first. The banner is going to stay on the screen no matter where I go in this patient's record. This banner is going to be here. So I can make sure that I am still on the correct patient. This is my patient's name, birth date. If there's a date of death, that would be listed right here, age and gender. You can see also that I have some icons here. These are alert icons. So maybe if I was viewing this, I am on a big monitor, so you can see my full screen. But if I was viewing this on a tablet, then I may not see quickly that he has some allergies. So I can actually select that icon up here, see that he has allergies, and go to that screen, be able to see it, get back out of this record and go back to patient care there. This one's telling me that he has had patient demographics that have been updated recently, so I may want to check that out. You may have some text up here. When you first access this record, if there's been a big data dump for this patient, then I might get some text saying, still pulling in information, please refresh. It will give me a little refresh button to do. I'm just selected and everything will start appearing. That only ever takes a couple of seconds depending on your internet connection. You can also use your refresh button up here on your browser. You'll see that I have the sensitive data button here. SEL is not allowing override of sensitive data, so you will not even see that button. So you don't have to worry about this here, but this is telling me that David does have some sensitive data in his record. And if I want to view that, and if I'm in a role that has that option, then I have to do that under that button. And again, that does go on an audit log report under your username if you do override sensitive data. If you do override sensitive data, you will have text that appears here reminding you that you are viewing sensitive data and that you need to keep that confidential. You also have this ellipses. Again, this is in the banner, so it's going to stay with this patient no matter what screen I go to, because it's going to give me access to a couple of different things. If I select the ellipses, it's going to give me a flyout of this high-level demographic information again, so I can make sure that I'm on the correct patient. But this also gives me access to the patient summary. And this is really where you can find all of the information on your patient in one place. So I'm going to select Access Patient Summary, and it's going to bring me to the screen here. Now, this does default to the HTML format, which is just an easier way to view computer language on a screen. And you can see it's pretty easy to view here. And it does default to the basic summary report. So this report contains patient demographics, allergies, medications, encounters, diagnoses, and laboratory results on the patient that you have accessed here. And as you can see, that's a pretty nice report there. You can change this format to PDF. Now, I do need to talk to you about PDF because there are some options inherent with PDFs that SEL does not want you to use. There is a download button here where I could download this PDF to the device that I am using. Please do not use that download button. SEL is not allowing the download of protected health information. This will download to the device that you're using. So it will be there to be accessed by other people who use that same device also. You also have this print button that is inherent to PDFs. Please do not use the print button. Please do not print protected health information unless your organization allows that. And I don't know of any organization that's allowing that right now. So please do not use that button. I think the PDF is a little bit harder to view on the screen, so I usually keep it on the HTML format here because it is a little bit easier to view there. Again, this is the basic report. You can change it to the expanded report, and the expanded report is going to be a really nice report when all this information is coming in on the patients. Right now, we do not have all this information coming in, but eventually it will be. So the expanded report, you can see that it kind of grew here, but if it doesn't have the information on the patient, it's just going to say none under that column. So upcoming appointments, patient-clinician relationships, support contacts, program memberships, diagnoses are on here, immunizations, when that starts coming in is going to be here. Problems, physical exams, observations, all of these nice things that are eventually going to be coming into the HIE is going to make this report really nice. And again, this is where you could come to view it all in one place here. Now, you will not have the send button. This is if you have direct secure messaging through Big Sky Care Connect, and SEL is, I'm pretty sure, still using their EHR or their third-party direct secure messaging provider for that. So you don't have to worry about this because you won't even see that send button. This download summary button here. Now this, of course, use your organization's policies around downloading this protected health information, but this would be a way to download this report and be able to attach it to a direct secure messaging email in order to send it for a referral or an observation or however you need it to do that there. SEL is only allowing, I think, certain users to use the download summary. I'm going to show it to you just in case you're one of those users. Keep in mind that it will give you this warning here that you are downloading this document and there is a risk associated with that, with downloading protected health information. It will tell you that this report is for David. It does have what I selected here. I can change that if I wanted to the expanded report or to the PDF if I wanted to from here. You can just send one specific encounter if you wanted to from this screen right here, or you can go to filter and have a couple of different options here. Now you can filter by days back. If I just wanted to send the last 30 days, the last 127 days, the last 42 days, I can put that number in here and it will filter that report back to that. You can also filter it by source. Let's say that I just wanted to send the medication list to someone. I can remove all the other sources there and just send the medication list there. Make sure that if you make any changes up here, you hit apply filters. Now let me show you what that does. And you don't have to go through each of these sections individually if you don't want to, but I'm going to show you what they look like here. So let me make this bigger so you can see what it looks like. Here, this is included under patient demographics. It's going to include this information. Let's say that I don't need that one right there. I can uncheck it if I want to. Now, each of these sections will allow you to clear all and select all. Now, because of the choices I made up here, I shouldn't have any of this other information that's going to be included because all I want is the patient demographic information and the medication information for this report. So as you can see, none of these boxes are checked here under any of these other sections. Now, if I wanted to, if I thought about it, I was like, oh, well, maybe I do need to send that one also. I can go ahead and check it there. But all of my medication lists will still be there because I still have the source listed up here for that medication information. I can preview the report from here. As you can see, it's going to give me the demographics and just the medication. None of the other lists are there. And then I can close that window and download that report. Now, notice that it is downloading to the device that I am using. I can open it from there, but when I'm done, when I send this for referral or whatever I need to send it for with direct secure messaging, I'm going to go to my file section here on my device. I'm going to go to my download folder. I'm going to find that clinical summary and I'm going to delete it off of here so that it is not there for the next person that uses that device to see. Any questions over the patient summary? I'm going to go back to the clinical summary here. We'll talk a little bit more about this. Again, it is designed to give you that quick information about the patient. It is divided into 6 different sections here. We do not have clinical documents coming in yet. I think we do have a couple of sources that have just started contributing those. And when that has been tested and implemented in the HIE, you will see those start to formulate here or appear here. So right now that section is going to be blank when you get into the HIE. Each section has the 5 most recent results for that section. Obviously, if there's just 4 or 2, then it's going to have those until more results get there and kick those out. For diagnoses, I can see that it has more than 5 because it has this next button here. If I was interested in the holistic picture of diagnoses at this point, if it has more than 5, I would go to the conditions tab and view the full list of diagnoses because it would just be easier for me to see it that way than scrolling through it 5 at a time. And I'll show you that in just a second. But if it's just this most recent diagnosis that I'm interested in, I can get to the details from here by selecting the details column, have the detail information there, get what I need, get out of this record, get back to patient care. For lab results here, you can see that I have a red bar with these results right here. This is telling me that there are abnormal results listed for that lab order. So I may want to check that out. I can get to the results from here and the details from here. I'm going to show you the results. The results details will take me to this screen right here. This is also where that details column will take you also. So just select one or the other. But I have the details up here. I can get to the order details for this lab order if I needed to. Here are the order details. If I hit the back to button, it just takes me to the screen that I just left. I can see here in the chart that I have red bars, again, signifying that there are abnormal results, and the results are in red also. So this draws my attention to it so I can pay attention to that. And for each of these test items here, you can actually click on them and be taken to the test item details for that. So if you needed to look into it a little bit more, then you can see it that way also. Scroll down to the bottom. If there are any comments, that's going to be down here at the bottom. You can also use a cumulative view. So if David had, again, he is a test patient here, but if he had had a similar test in the past, then it could compare the results for me here. It would list the second test here, and I can compare the results. I can also graph that. It doesn't look as good if it's just one result here, but you can pick what you want to include on the graph. Make sure that you scroll down here to the bottom and hit refresh graph, and it's going to plot those details for you there. So you have a few different options there with lab orders. Back to the clinical summary here. Allergies, he only has 2, so I can see all the information that I need to from here on his allergies. Diagnostic studies, you can get to the actual details from the diagnostic study here. Let's look at the rest echocardiogram. You can see that the details are right here. I can see the results here, and I can scroll through that. Let me scroll down some, scroll through that if I need to. Comments here at the bottom. I can get to the order details right here by selecting order details. Anything that you see in that blue signifies that it links to another screen there, so you can select it. Go back to that. And then the medication list here. And again, I can tell that he has more than 5. Most patients have a pretty healthy medication list. So if you're interested in the holistic medication picture for the patient, I recommend that you use the medication tab to look at that, because you can see most of it all in one place at that point instead of having to scroll through it 5 at a time. But if it was this most recent medication I was interested in, I can hit the details from here. Again, it's a test patient, so not all these fields are completed. Up here at the top, it's going to give me the medication name, the dose, the form, and the duration of the medication. So if that's all that I needed, I could get that here and get back out. Or I can look at the administrative details here. Here's the fill date if I needed that. Order notes here, these text instructions. This was what was written on the script for the patient. So I can actually confirm with my patient that they are taking this medication in the way that it was prescribed. And then the order details down here at the bottom for the medication. So that is the clinical summary. And again, all of these sections and other sections do have a corresponding tab over here. If a tab has information on it, it's going to have a blue bar. If it's empty, it's not going to have a bar with it. So I know that I don't have to waste my time looking at that tab because there's no information there. Again, we're going to have documents, immunizations, vital signs, and histories coming in eventually. When that starts, I will release a training video on it so you know what to expect. For the diagnoses, again, if I wanted the holistic picture, I would go to the conditions tab in order to see all of those diagnoses listed here in the same place, or at least most of them, depending on how big the list is. All of these tabs act in the same way. They are all broken down by lists, and the lists are all most recent result to the oldest, unless you have changed that sort option there. Also, each list will allow you to search it and change the sort options if you need to. To search a list, simply just put in the keyword that you want to search for, hit enter, and it's going to display those diagnoses or whatever list you're in there with those keywords. In order to get back to the full list, just delete that out and hit enter again, and you're back to the full list there. Again, different sort options. You can either select the column header in order to change that sort. So if I wanted to see the oldest result first, then I can just select the column and it's going to sort that for me. If I want to put it back, just hit it again. If I want to sort it by alphabetical order, I can hit the diagnosis column there and sort it by alphabetical order, or just put it back to the way that it was there. Okay. If my patient had any problems, then those will be listed down here. So it'd be the problem name, the onset date, the end date, which is what signifies it to move to the historical problems, provider facility status, and date. Again, I can search and sort each of these lists here. For allergies, we pretty much saw everything that we needed to from the clinical summary, but I do like this. If David had more than 2 allergies, you can actually sort them by category. So if you hit the category column, what that's going to do is it's going to lump all the drug allergies together, all the food allergies together, all the environmental allergies together, and you can see all of those allergies pictured in that one category. So it'll give you a better look into those allergies. Medications, again, it's usually easier to view this on the tab because most patients do have a healthy medication list. Our only source for medication data right now is Dr. First. Dr. First does have access to most of the major pharmaceutical databases and some local Montana pharmacy databases. And we will have other sources providing medication data at some point. Again, those connections have to be made, and we have to have an organization that's contributing that data. We will have some local pharmacies in Montana contributing that data. And I think we're going for some nationwide pharmacies also. But right now, it's Dr. First that is contributing this data. Dr. First does update their database every 4 hours. So it is a really current medication list for patients that are in the HIE. And it was a really easy first connection to make in order to get that information coming in for the patients. We wanted to make sure that there was information coming in for the patients on medication. So again, the source, you'll see it start to change as we have organizations that start contributing that data. I'm gonna get the medication name, the source again, right now it's just Dr. First, the ordering provider, the start date with the source. Now, if the start date is under 90 days, it's going to be included up here in the current medication list. If it's over 90 days, it gets moved down here to the historical medication list. And then you're going to have the details column, which you can see the details of the medication there. Now, I do recommend, if you are interested in the holistic picture of medications for your patient, that you do a secondary sort here on the medication list. And what that means is that you can hit the medication column here, and this is going to lump all the like medication together. And it usually sorts by most recent to oldest, but just to make sure, I'm going to go under here, go to secondary sort by date. I want the newest to the oldest, so I'm going to select that column there. And now all of the medications are still lumped together, but they're listed most recent to oldest. So that gives me a better view of, I can tell that David took the sertraline pretty regularly between this period of time here. So it's not all over the place, and it kind of groups them together a little bit better there. Again, to see the details of any medication, I'm going to go here to the details column, medication name, dose form, and duration up here at the top. Look at the administrative details, text instructions, what's written on the script. Go down here to the order details if I need that information. For lab results, pretty much we saw everything that we needed to see on the clinical summary there. I can see here that these results listed here. So we have the results by date that's listed here in the tab. Sometimes that's easier to see than the way that they have it listed in the clinical summary. So you might come here to see it this way, but you can get to all the same things that you got to on the clinical summary. Again, anything abnormal is going to be red, so it draws your attention. You can click on the line item detail of each of these, the result, the order, the cumulative trend that I showed you. So all of it is here for you to look at. Oh, went back too far. I'm going to go back to the clinical summary. Just a second. There we go. Let's go to diagnostic studies. Again, we saw everything that we needed to see on the clinical summary because we only had 2 of them. When we looked at the rest echocardiogram, we can look at the bone density study here and see again, here is the study, here is the results. I can scroll through those and I can get to the order details here on the screen. Procedures. Now you can't see this information on the clinical summary because it's not listed there. So the only place that you can see the procedures is to come here to the tab. It's going to give you the procedure name, the procedure date, the provider, and the facility. Again, you can search each of these sections and sort them in different ways if you needed to. Histories are coming. This is where you can come to find family history, social determinants of health for the patient. So that's going to be a really nice tab when we get that information coming in. Encounters, again, this isn't available on the clinical summary. So in order to see any inpatient, outpatient emergency encounters for my patient, I could come to this tab right here. It's going to give me the type, the start date, the end date, the provider, the facility. If that encounter resulted in a diagnosis, then that would be listed here. Discharge disposition. Here's the local medical record number associated with David for this encounter. And also the individual insurance per encounter. So if I was just interested in what insurance David used for this most recent encounter here, I could select the insurance information here. Now he doesn't have any insurance information, but if he did, it would list the payer code, payer name, the plan, the card number, when is it good to, and the card holder name here. He does have a self-pay on here. I think it's under this one. So I can show you what that looks like here. So it's just self-pay, and the plan is SP there. Now, if you are interested in the insurance that David has used for, or the most recent insurance that David has used or something like that, the best place to get that information is off of the demographic screen that we're going to next, because it will have a list of all the insurance that he's ever used, along with the date when he used it. So if you need to compare that to the encounter, then you can get that information from the demographic screen and then come back to the encounter screen in order to compare it there if you needed to. For encounters, you can group all the inpatient, emergency, outpatient encounters together if you wanted to. There's eventually going to be observations here also. We just don't have any organization that's contributing that data just yet, but we will eventually have that here too. Under demographics, it is broken down by section, so the information is easier to view that way. We have the patient details, address details, primary care contact, clinical details, additional demographics. If there was a date of death listed up here, then this is where that information would be included here. These are in blue, so I can tell that they are linked to another screen. This is every active medical record number that David has in the system. I can select that to be taken to that screen. Again, this is maybe information that my coders and billers can use next time when they're looking for information on David, or that I can use to access them next time if I wanted to. If my patient had any patient contacts, those would be listed under the screen. So it'd be the first name, last name, relationship, contact type, and then the contact information here. This right here is just for audit purposes. So this is the date and time this patient was last updated, along with the hospital facility organization that did the updating and the user that updated the information. This all does go on an audit log report. This is where you can see that list of insurance. And again, he only has self-pay, but if it was other insurance, it would have the date here. So I could compare the date with the encounter that it was used on. So I don't have to look through each individual encounter until I find that most recent insurance, because it's going to be listed here. All these lists, again, are most recent to oldest. So the most recent one will be at the top here. And I can search and sort them in different ways. And again, support contacts, if he had any, those would be listed down here. Any questions over any of the tabs here or the clinical summary? Okay, just a couple of other things to point out here. Unless you have direct secure messaging through Big Sky Care Connect, if you try to access this envelope, it's just going to give you a stop sign and you won't be able to access it. But I will point out this My List, which is really a cool feature that we have in the HIE. First, if you want to go back to the search and viewer at any point, just hit the magnifying glass here and that will take you back to the search and viewer. So you can search for another patient at that point. But this My List is really handy if you are the type of person that wants to keep track of patients that have a specific condition, or patients that are on a specific medication, or maybe just the patients that I'm going to see this week. I want to go ahead and get them in here. So all I have to do is click on their name to open up their record, so it's available when they get here and I don't have to worry about searching for them when they have arrived. Whatever way this is most helpful for you, use it, because this is a great option, especially if you are the type of person that likes to open up separate tabs. We have a lot of people who in their EHRs, they like to open up a separate tab for each patient that they're going to see that day, and then just click on that tab when they are seeing the patient. That won't work for the HIE. The HIE has a timeout of 15 minutes, which means that if I don't touch one of those tabs for 15 minutes, it's going to kick me out of the whole entire system. So you can't really do that with the HIE, but you could do it with the My List here. Go ahead and just enter all the patients here on the My List, and then you just come here to click them and view their information when they get to their appointment. It's very easy to add patients here. You're going to go to Add Patient. It's going to take you back to the patient search and viewer. You do still have to meet the minimum criteria. Again, I have a hard time talking and typing at the same time here. And in David's information, I'm going to search. It says My List up here, so I know if I select this, it's not going to open up his record. It's just going to put him on My List. Now, when I log into the system next time, Instead of having to search for anyone at this point, I can come to the My List. I can see David's name here, and I can select him straight from here. So I can open up his record from here and skip that whole search and viewer step because I've already done that. And I'm sorry, my internet's a little slow right at this moment. So it's supposed to open up his record, and it will eventually because there it goes. Just moving a little slow here in Kentucky. But that's a good option if you like to open up tabs or just be prepared for patients that may have appointments this week or whatever. To remove a patient, very easy. Just go over here to the ellipses, hit delete patient from list, and it will take the patient off of there, and you can add new patients on that. Okay, so use that in whatever way is going to be helpful for you. Notice that it does have this override consent policy checkbox here. If I was to add a patient on this list and sometime between me adding the patient and me needing to access the patient, they opted out or their record contains some sensitive data, then I could override it from here. But again, SCL is not allowing that type of override unless you're in the emergency department. And the only other thing to point out is under your username here, you'll see that there is a profile button, and for some reason mine doesn't want to work. So let me log into my testing environment here so I can properly show you that, because SCL does want you to put in a challenge question and challenge answer on your account. Give me just a second here. I've reported that issue a couple of times. We'll get that fixed. Okay. Right here, if you go under your username and then to profile, it's going to bring up your account information. Now, all you are required to have in your account is your first name and last name, and the help desk will put that in there for you. If there's a spelling error or something changes, you can change that. Just make sure that you hit save account when you do change that. You can put in your mobile number if you want to. Every 90 days, you're going to get an email that says, hey, your password is about to expire in the HIE. Please get in there and change that. This is where you can do that. Or if you're just the type of person that likes to change your password often, this is where you can come and manually do that yourself. But if you do not get into the HIE after, let's say that your password has expired and you weren't able to get in there and change it, it's not really a big deal, because on the login screen, it's going to automatically prompt you to change it if your password has expired since the last time that you logged in. So you don't necessarily have to come here in order to change that password unless you just want to. This is where that challenge question and challenge answer is. Again, it's optional, but highly recommended, and SCL does want you to utilize this option here. What this does for you is if you have a challenge question and challenge answer in your account, then you can reset your password that you forgot on your own instead of having to go through the help desk to do that. If you do not have this information in here, then you have to go through the help desk in order to reset a password that you have forgotten. So simply just put in whatever your question is, and mine's not even really even a question, and your answer there and hit save account, and that will update in your account. You have the about, this is just the system information there. Settings and help, this is coming. Help will link to the help desk straight from here. So if you had any questions or needed to chat with them, then this will eventually link to that. And then you have the logout. Again, the system has a timeout of 15 minutes. If you don't touch anything in here for 15 minutes, it's going to log you out. No warning, it just logs you out, and you have to get back to where you were if you needed to get back in. Of course, when you're done using the system, go ahead and log out so that no one can come in behind you and use your username there. So I'm going to go ahead and log out of there. Any questions before I totally leave the system? Okay, we are almost done, I promise. As far as just troubleshooting, if you are still waiting on that welcome email or emails that have your username and password in it, and you should have gotten it by now, make sure that you check your spam folder. A lot of times it goes there. If you still don't have it, then go ahead and contact the help desk and let them know. Now, if you requested access to the test patient in production, to David's record, and we have a couple of other ones in there also, then you will get another email with another username in it also, because you have to have a specific username in order to be able to access that test patient and be able to play around with the data in there, because we don't want you messing with real patient data. But if you have that, then you'll have a totally separate email with that and a totally separate username to be able to get into that and be able to use that patient. If you forget your username, again, we don't encourage the changing of usernames. You could have an additional username if you requested access to that test patient or to the training environment. But we usually don't encourage changing those usernames unless there's a security concern, because we try to maintain a naming convention with that. If you forget your username and you cannot find that original welcome email that has your username, then contact the help desk. And you can send them an email if you don't have time to be on the phone with them. Just send them a quick email and say, hey, I forgot my username. Can you please get that to me by lunch so I can get into the system? And if they need to talk to you about it, if it's something that they can't send through email, then they will call you at a more convenient time. If you try to log in for 3 times and fail, then your account will become locked and you must contact the help desk in order to get it unlocked. This is where that forgot password button comes into play. So having that challenge question and challenge answer in your account means that if you put in your password incorrectly the first time, you're going to get access to this button. Now, you can do it up to 3 times, but if you do it the 3rd time and it's still wrong, it will lock you out of the account, and then that forgot password button doesn't come into play anymore because you're locked out of your account. So make sure that you don't do it more than 2 times, and then go ahead, and if you haven't remembered it by then, hit forgot password. It's going to pop up this new box. You need to put in your username. It's going to display your challenge question. You're going to put in your challenge answer. It's not case sensitive, so if you have all uppercase in your account and put all lowercase in here, it's fine. It's just based off the characters. Put in your answer, hit request email. That's going to send you a temporary password to your contact email that you registered with. And then you're just going to go through logging back in with that temporary password and changing it to your new password there, okay? Seems like a lot of steps, but it is a lot easier than having to contact the help desk and go through all that with them. If you forgot your password and you cannot use that forgot password button, then you have to contact the help desk to have help with that. This is just a reminder that if your contact email, that's that email that you registered with, that your welcome emails come to, that if you forget your password or you need a temporary password, or hey, your password's about to expire, that's that email that all those come to. If that happens to change at all, just send a quick email to the help desk and say, hey, my contact email has changed to this. Can you please update my account with that? And then that way, when you do need that email to come through, it's coming through to the correct account. And that's what I have. We have learned how to get started with the HIE, how to use the search and viewer, when it's okay to override that patient consent. And again, remember to use your organization's policies around that. The clinical summary, how to view the patient summary, and the functions available on the menu and your user profile. If you need any further assistance or would like to learn more about Big Sky Care Connect and the HIE, please reach out to us. We are here to help. We want to help. We want you to be able to use this system. If it's not working for you, if there's something that it's not doing that you need it to do, if you have suggestions on things that you've seen in other places that you'd like it to do, please let us know. We want to work with you on this. We are partners with you on this system, and we want you to be able to use it efficiently and effectively for you. Because if it doesn't work for you, then you're not going to use it, and it's not going to be that system that we need it to be. So please reach out to us. However, it's easiest to do that. Help desk me, your outreach coordinator, just let us know, and we'll be happy to work with you on that. Again, I'm going to send a follow-up email later today. It's going to have a link to this training in it. Use that however you need to. I'm also going to have a link to our training evaluation survey. It only takes a couple of minutes if you would complete that for us, because that lets us know that we are on track with our training program and providing you the information that you need. Does anybody have any final questions for me? You guys have been a quiet bunch today. Okay, I want to let you know that at Big Sky Care Connect and me personally, that we appreciate everything that you do. I know as healthcare workers, it's been a difficult 1.5 years in the past with COVID, and just want to let you know that we appreciate you. And please let us know if you need anything at all. Thank you guys. Have a good day.